want to talk for just a minute here about what happens with that heavy carbohydrate diet. So if you are on one of these heavy carb diets and you're not getting adequate protein, and especially you look at this diagram here, so these things up here that we're drawing or that we're making allusion to, these are common compounds found in grain. That's why you see here, this is the grainflammation, grain-induced inflammation cycle. So I'm going to talk in just a minute about protein digestion, so stick with me, but I want to get to this. So these are the things that are commonly found in our modern grains, right? We have gluten, so if you're gluten sensitive, that's a major issue. We have GMOs, the glyphosate, and the GMO modification of grains. We have pesticides, aside from glyphosate, like atrazine. We have ATIs. These are proteins, amylase trypsin inhibitors. These are proteins that can suppress digestion and cause inflammation in the GI tract. We have heavy metals. I don't know if you guys saw this, but here just a week ago, major carrier of rice-based baby formulas pulled their product in a massive recall because of heavy metal poisoning or heavy metal contamination. We have omega-6, excessive quantities of omega-6, which contribute to inflammation. Grains oftentimes are contaminated with mold and mycotoxins. We have the fact that we know they can cause, especially this gluten here, can cause intestinal permeability and leaky gut. And then we have also, we know that grains is a staple in the American diet. 50%, more than 50% of calories is, for most people, is from wheat. And that doesn't count the other grains, it's just wheat, right? So we count oats and we count corn or we count rice, that number goes up. That's excessive carbohydrate, right? And so what happens? When you plug all of this into your mouth, this funnel represents your mouth, okay? It's coming down, it comes up, and one of the byproducts is inflammation. And we know that whether you're gluten sensitive or you're reacting to the metal or the omega-6 excessively is inflammatory to you or the pesticides are creating inflammation, we know it creates inflammation. Now, if it's from a carbohydrate perspective, carbohydrates increase insulin. And excessive insulin increases obesity. It increases central adiposity, which is fat around your waist, fat around your visceral abdominal tissue, which is around your heart, around your intestines, etc. It's the most dangerous kind of weight gain to have, and we know that that increased type of fat increases cortisol. So follow me here. So we have this increased inflammation in step one, and from there we keep going, and we get inflammation leads to your body's normal response, which is to make cortisol. Now, cortisol does what? It's like a fire truck. So it puts out, or tries to put out the fire. That's why your body's producing the inflammation. Your body is trying to put out the fire from the food that you just ate. Now, we know that cortisol is catabolic, and so what happens is cortisol leads to muscle loss. It's a natural byproduct of cortisol's reactivity. So any of you ever had a steroid? Raise your hand in the room. Just, say yes if you've ever taken cortisol or a corticosteroid or had a doctor give you an oral steroid or inject you with a steroid and you got chubbier or you gained a bunch of weight when you were on that. It's because cortisol causes muscle loss and weight gain. Okay, so it causes muscle loss catabolically, breaking your muscle down. It causes weight gain because the byproduct of losing your muscle is losing your metabolism, so your weight will naturally go up. But beyond that, cortisol doesn't just cause muscle loss. Cortisol also increases insulin response, which again, coming back over here, increased insulin, increased weight gain, and increased cortisol. It's a vicious cycle between cortisol and insulin. It just keeps spinning. And then that weight gain leads to, for most people, it leads to a joint compression, it leads to joint pain because you're putting more weight on your joints. Just think about it for a minute. If you weigh an extra 10 pounds, right, more than what you should, and you're walking, that pressure's on your knees, that pressure's on your spine, it's in the base of your neck. So That most people aren't 10 pounds overweight, though. They're 30, 40, 50 pounds overweight, especially chronic adults in the United States. We're at a 60% obesity rate in the US today. That's more than 10 pounds of a little extra weight. We're talking about extra half people that we're carrying around. Imagine piggybacking somebody who weighed 50 or 60 pounds all day long every day. That's what happens here. And then your joints start to collapse. They start to break down. They start to get increased wear and tear on them, right? And then what? That's inflammation, right? So your joints become inflamed, and that's what we oftentimes refer to as arthritis. This is why when people start having pain, they go to their doctor, right? And what happens is they get prescription pain medications, and then those pain medications will do what? They'll block the inflammation, but they won't block the cortisol response. They will tamper down the inflammation, so they'll put the pain on the back burner to a certain extent. They'll mask the symptom, but it will not change the hormone profile. It won't change this hormone profile or this hormone profile. Now, beyond that, we know, depending on the kind of pain medication, so let's say your doctor gave you an NSAID, that stands for non-steroidal anti-inflammatory drug, and so NSAIDs, that would be your ibuprofen or your aspirin or your Celebrex. These are non-steroid-based drugs that suppress inflammation. And so NSAIDs cause vitamin C, iron, and folate deficiency. Okay, so NSAIDs reduce. This is over time. This is not overnight. So if you took ibuprofen, one time this month, that's not what's happening here. It's the constant use, the consistent use. So you get vitamin C, iron, or folate deficiency. These three nutrients, what are they important for? Joint and cartilage formation. So it's hard to produce cartilage, it's hard to repair a joint when your vitamin C levels are low. It doesn't happen. And this is why these NSAIDs are a bad idea nutritionally, because they don't fix why the inflammation's there, and they create nutritional parameters that lead to increased risk for the development of more arthritis. Now, that's not all. NSAIDs also cause leaky gut. They cause even a baby aspirin. So many of you are taking aspirin. I had this conversation with a patient earlier today. Doctor wanted them to take a baby aspirin and said there was no side effects. And what you should know is a baby aspirin is 10 times the dose required to cause gastric bleeding and ulceration. That's a baby aspirin. 10 times the dose of what it takes to cause bleeding or ulceration of the stomach. It only takes 7.5 milligrams of aspirin to do that. So we know they cause leaky gut, and they cause what's known as occult blood loss, which is loss of blood through the stool due to the damage. They strip away the mucosal lining. So that's just the NSAID, right? We're just getting warmed up here. What if you didn't get put on an NSAID? What if your doctor instead decided to go for the big gun and they prescribed corticosteroid? Corticosteroids are the big guns. And I've seen this a lot with people that come to see me. They're on low doses of corticosteroids, like 5 milligrams or 2.5 milligrams. But even at those lower doses, corticosteroids cause bone loss, and they also cause muscle loss. This is what we were just talking about. Your own cortisol can create muscle loss, but external corticosteroids coming in can also do it. So bone loss, muscle loss, they also increase your blood pressure. They also deplete your body of magnesium and calcium and vitamin C and vitamin D and zinc, to name a few of the nutrients. So you think about that for a minute. You're trading your inflammation, right, which was caused by what you're eating. You're trading it in for a medicine that blocks that inflammation but causes the very same problems that we're trying to avoid. Because remember, at the end of the day, it doesn't matter what kind of drug or medicine that you take, ultimately the end goal is to have you out of pain, but not just to have you out of pain. It's so that you can function. It's so that you can be healthy and happy and function. So if the drug solution is not going to lead to that outcome, then what you're really just doing is buying a little bit of time while you're creating chronic disease as a result of drug-induced side effects. So corticosteroids, another common drug used for pain. Another common one, and this one's over the counter, and that's Tylenol, right? And so you may just pop Tylenol or acetaminophen. And so this has been shown to reduce or to cause glutathione depletion. It also damages the liver. Glutathione helps your liver heal and repair and detoxify. So if you're taking chronic acetaminophen or Tylenol, you're basically, you're reducing your liver's capacity for detoxification. And so now every toxin that you're being exposed to, you're hindering your liver's ability to get rid of those toxins, and then you get excessive toxin accumulation within your body. And of course, that's going to lead to inflammation in other ways, right? So you don't necessarily want to trade that off. And then lastly, not lastly, but one of the last ones that we'll talk about tonight, we could talk about this all night, would be your class of medicines that are even more potent. So like your opiates. So this would be things like OxyContin, Dilaudid, drugs that are highly, highly addictive, right? And these drugs affect the gut. So they really slow it down. They reduce the gut motility. They can cause severe constipation. But beyond that, they alter neurological perception of pain. And that doesn't come free. Like when you take these types of medications, I think it was it last year or the year before, we had, I want to say in the neighborhood of 15,000 deaths from the proper use, not from abuse, not from addicts, but just from the proper drug prescription, 15,000 deaths. As a matter of fact, Thomas Frieden, the ex-director of the CDC, said, we know of no other drug that causes death so regularly for the treatment of something that doesn't necessarily kill you, which is pain. So where this class of medicine should be used is in like somebody whose quality of life, maybe they're struggling with cancer and they're on hospice care, and we're just trying to ease their pain. Like that's true pain control, that's true compassion. But I have had patients that come to me and their doctors are writing opiates for headaches. Their doctors are writing opiates for arthritis, which is absolutely, in my opinion, it's crazy. And it sets the stage for complete failure. So we've got those medications that are major ways that doctors will prescribe in order to block that inflammation that was being caused by what was being ingested. And so this is the Grainflammation cycle, but we could put other things in here as well, couldn't we? We could add to this list, we could add trans fat, we could add sugar, we could add food additives, okay, we could add other environmental chemicals. All of these things have to run through your body and can have the potential to create an inflammatory situation that can lead to prescription drug use to try to block the body's natural alarm system. Remember why this pain is happening. It's not happening so that you can mask it. It's happening because your body is trying to warn you to quit doing this and to quit doing this. So listen to the warning, don't ignore it. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.